Hello, my name is Tala, and my project this year was centered around preeclampsia. So first off, I was able to shadow a few times, and throughout my shadowing, I saw a lot of consultations with like IUD insertions, just regular pap smears, and a lot of times I saw mothers coming in for their 6-week checkup. And in that 6-week checkup, a lot of times a really frequent question mothers would ask the doctor would be, when can I start having children again? And for most mothers, it was a really simple answer, just that the doctor would just give them like a matter of time or weeks or months. But with with mothers that struggle with preeclampsia throughout their pregnancy, it was a lot more complicated of an answer, and it was kind of upsetting to see the mothers not be able to fulfill the goal of having children that they wanted to in the time frame they wanted to. So my project was kind of set to try to combat that issue, which is preeclampsia. So preeclampsia is a condition that occurs in pregnant women, and it is dealing with an organ that develops in pregnancy, which is called the placenta. So the placenta develops during pregnancy, and it's attached to the wall of the uterus, where the umbilical cord arises from. And the placenta's purpose is to provide nutrients and oxygen to the growing baby and then removing waste. And in certain pregnancies, the vessels that go to the placenta don't seem to function or develop properly, so hormonal issues, or they're just way narrower, and it creates high blood pressure. So this is like a normal placenta's blood vessel, and this is a preeclamptic one, and then same here, normal preeclamptic. So it's a lot narrower. And preeclampsia can be caused by a wide variety of things. Some really important ones are like diabetes, before or after or during or the pregnancy, if you had preeclampsia in a previous pregnancy, and then your age. So if you're really young or a really old mother, you're more likely to develop preeclampsia. And then there are certain non-biological factors. So the first one being like race. Black women had the highest age-adjusted prevalence of preeclampsia, which was 12.4% compared with white mothers at 7.1%. And another issue too is if the mother is underinsured throughout the pregnancy. So in the perinatal period, which is at conception to 1 year after birth, if they are underinsured at any time in that time frame, it can increase the chances of developing severe preeclampsia due to a lack of early detection and proper treatment. So early detection is so important because after they do detect preeclampsia in these mothers, they then have to go in for weekly visits, and it's a lot more frequent than if just a regular pregnancy without preeclampsia. And so the current treatment surrounding preeclampsia is a lot of times it's centered around medication, so antihypertensive drugs to lower the blood pressure, anticonvulsant drugs to prevent seizures, because preeclampsia can develop into a condition called eclampsia, which can lead to seizures in the mother, and corticosteroids, which can help develop the baby's lungs. And severe preeclampsia, oftentimes the doctor will recommend will deliver the baby before the 37-week mark, which means the baby is premature. And these drugs, corticosteroids, make sure that the baby's lungs are hopefully developed enough to sustain life after they're giving birth to prematurely. So in my research, I found a lot about how these solutions or treatments are doing that, treating the disease, and I wanted to take a more preventative approach. So my first and my main solution is to institute a more comprehensive sex education plan. So like I said earlier, age is a big factor. A very young mother has a high risk of developing preeclampsia, and the best way, or one of the good ways to diminish preeclampsia or diminish adolescent pregnancy is through proper sex ed. So in the US, sex ed is pretty lacking. The biggest issue is that sex ed is not mandated federally. It's up to the states to decide what they want to do with sex ed. So this graph right here it's kind of hard to see, but every block that's colored in is like a different policy that's applied to sex ed. And as you can see, there's a lot of variation across the states, with some states not mandating sex ed at all, some states not even mandating that it must be medically accurate, and a lot of other things. In 2016, the US had the highest rates of teen pregnancy amongst industrialized countries, and the 2004 Waxman report found that 11 out of the 13 most commonly used curriculum were medically inaccurate. So they're not even teaching them the right stuff. So I would want to reallocate the funding, the state and federal funding that goes towards sex ed, to a more mandated, like a federally mandated plan. So every single state is doing the same exact thing, and it must be medically accurate. And in states with medically accurate sex ed, their adolescent pregnancy rate is about half of those with states without medically accurate sex ed. So we know that it'll probably work. And in California, the health curriculum framework is already kind of doing this, and California has one of the lowest adolescent pregnancy rates in the country. My second and my other solution is to increase insurance coverage. The most common insurance coverage for underprivileged mothers in America is Medicaid, but about 34.5% of mothers with prenatal Medicaid coverage were uninsured at some point during their perinatal period, so it's not really doing what it's set out to do. So I would want to incentivize mothers to attend or to go to these doctor appointments with finding them coverage for all the ones that they'll need after they get diagnosed with preeclampsia, and we can incentivize them with free transportation, so like partnering with Lyft and Uber, and providing them free passes to go to their appointments, especially for rural mothers who do not live in areas with a lot of offices that offer obstetrical care. And then another thing too is to incentivize them to go to their appointments by offering them, things like prenatal vitamins, baby or diapers, and formula, and covering postpartum care to help manage preeclampsia can decrease the rate of preeclampsia in these mothers and will make it less likely they'll develop it. Okay, I think